some papers up. Okay, folks, so we're going to get started here again. In this second part of today's lecture, we're going to be looking at motivation for agent-based modeling in public health. And I have a kind of substantive challenge here in the sense that the audience here is very diverse. And to some people here, it's going to be old hat. To some people here, it's going to be new thoughts. And to some people here, the health terminology is going to be very unfamiliar. So I'm going to just try to weave between the Charybdis and Scylla of this dilemma and see what I can do to provide some motivations, knowing that it's not going to be perfect for everyone. So I think much of the motivation here is it lies in the goal of public health is in some sense redirecting the course of change. This is a quote from Bobby Milstein, by which he's motivated discussions of much of the modeling work he's been involved in. And this graph shows a number of cases of sexually transmitted infection known as chlamydia, reported cases across Canada. And as a result of a great investment in public health resources, most notably contact tracing, but also investments in early detection such as in pregnancy, the number of cases of chlamydia really declined over time in the 1990s. And there was a sense that, we're really making progress in addressing this bug. But if you look at, the subsequent case numbers, they rose, and they rose quite dramatically to the point where people in the late 2000s were talking about a crisis, a real crisis facing sexually transmitted infections, control of sexually transmitted infections, based on the very large number of cases involved. And this was not associated with a huge rise in the population or anything. But interpreting this is a very difficult challenge. Why is this rising? Is it a sign of a tremendous problem, or is it a sign that we're actually doing testing better? Is it a sign of testing regimen where, it turns out one of the things that came in here in the early 2000s was less invasive testing strategies. So I won't go into the gory details, but suffice it to say that a lot of men who would previously have stayed away from STI clinics for fear of discomfort, we're actually willing to come in with their partners and be tested because it involved a urine test rather than a more invasive form. And so there's a lot of debate as to the degree of crisis and, in fact, the interpretation of this data. And implicit in all of this was the question of what's really going on. What are the processes that are changing over time to account for this fall and this rise? And are they signs of a failing healthcare system, or are they signs of great success in a healthcare system in bringing people in for treatment? And among other things, we contributed to this discussion by showing in a very simple model how you could reproduce this using only assumptions about on the testing side. That it was actually probably a sign that we're draining the swamp. Within this area, though, we're grappling with great complexity. Complexity involves